All right, we're back, everyone, with Dr. Tom Alassi. Keep saying that correctly. I was just admitting in the commercial break how much I love sugary foods. And boy, there is a spike. We're going to talk a little bit about the glycemic index and this sugar spike that we see in just a bit. 737 plus, if you'd like to call in. We've already heard from Mary as we talk about diabetes tonight. Let's go to line 2 and Jay. Hi, Jay.
Good evening, gentlemen.
Thanks for calling.
Doctor, I got a question. I'm a 40-year-old male, always been healthy, been very athletic. I was adopted, and I don't know my history, and I was just wondering, as a 40-year-old guy, what I should do. Should I talk to my local doctor about getting diabetes testing? And also, like Rory, I crave my sweets and Coke and sweet tea and all that, but I just wondered what I should do being adopted, and I'll hang up and listen. Thanks.
Well, that's a terrific question. You know, as Rory and I were alluding to just a bit earlier, your genetics matters. And so not knowing your genetics kind of leaves a piece of the puzzle out. But there are a lot of other pieces of the puzzle. In fact, if you were to go online to the American Diabetes Association, they have some risk factor tests that you can take that'll give you a little bit of a sense of whether you are at a high risk or a low risk of developing diabetes. And you'd be surprised, actually, that your family history, while important, is not dispositive. And so I think for you, that's going to be a piece of the puzzle that we don't know. We don't have great genetic testing to help us predict whether you're going to develop diabetes. So there's nothing in that arena, for example, like breast cancer, where there are certain tests that you can do. But I think if you're a healthy 40-year-old guy and you're watching your weight and you're staying fit and you're trying to eat healthy, that's fantastic. You should go see your doctor for routine health checkups. And as part of that, it's not unusual for them to do a routine blood test to see how you're doing. And they can look for diabetes at that time. But I just applaud you for staying healthy and being active and trying to keep your weight at a good level.
Yep, it's not always easy, we know. Jay, thank you so much. Let's go to Tim next. Hi, Tim.
Hello, how are you?
Doing well. Go ahead.
I have a problem. I'm a diabetic, and I have neuropathy very bad. I see on TV that they said, can neuropathy be reversed?
All right, hold on just right there. First of all, let's explain what neuropathy is. We hear this a lot.
Yeah, so Mary mentioned that her mom had kidney disease. There are complications of diabetes that are related to the elevation in the blood sugar, usually when the elevation is quite dramatic and sustained over a period of time. The three large categories that individuals tend to get are eye disease, kidney disease, and nerve disease. We call nerve disease neuropathy. In particular, it tends to be in the distal areas, so the areas like in your feet and just above your feet. And people have a variety of different symptoms, from pain to loss of sensation. Once that happens, that is a little harder to reverse, but it can be controlled, in particular if the dominant symptom that you're having is pain. There are good treatments for the pain, and I think it's also important when this happens to be really attentive to getting your sugar down. It's also important to remember that the mechanism underlying the neuropathy is small vessel disease. So diabetes, sometimes people will call it a vascular disorder because it so commonly affects the vessels. So the vessels that actually supply the nerves, really small vessels, can be damaged. So in addition to keeping your blood sugar under control, it really is important to control the other conditions that travel with diabetes. In addition, we mentioned depression, but two other super common conditions are blood pressure and high cholesterol. If you can take a holistic approach, get your sugar down, try to control the blood pressure and the lipids, and then there are specific medications that can help ameliorate the symptoms. I will say that it's hard to reverse neuropathy. Once it happens, it can, but it's harder, but it's certainly much easier to control the neuropathy.
Is neuropathy leads to, in some cases, we hear about severe cases of diabetes with amputations.
Yeah, so amputations are an extraordinarily sad and fortunately increasingly rare consequence of diabetes. In order to develop, to have an amputation, you need to develop oftentimes a lesion. Sometimes it progresses to an ulcer on the foot. And then that ulcer just doesn't heal. And then it can get infected. And it's hard to treat the infections because the vessels are so damaged that when I give you antibiotics, they just can't get to the site.
Right.
So the infection can spread.
And a topical antibiotic is just not going to do.
Yeah, it's not going to do it.
Right.
And the mechanism underlying that is in part the neuropathy, because one of the findings of neuropathy is that you lose sensation.
Sure.
So one of the real sad things that I've seen, fortunately less often now, is someone who comes in and stepped on something and was unaware of it. So I think this question also just reminds me to share the absolute importance of checking your feet on a regular basis.
Right.
These are such simple things, but they're so powerfully effective. And if you catch these things early, you're far less likely to have the ulcer, the infection. And if you get it, we treat it earlier, the better it is.
You mentioned in this, and we're really kind of stemming off from Tim's call here about neuropathy, but you mentioned the eyes, and
Yes.
we hear so much about eye issues with diabetics. What is it? Nerve damage? What happens to the eyes, and why are they targeted?
Yeah, so if I can have the audience remember, as a result of our time this afternoon or this evening, that diabetes is a vascular disorder. Where vessels are, things bad can happen with diabetes.
Right.
So the eye is an extraordinarily vascular organ. So part of the reason is because of damage to the vessels in the eye. The kidney is highly vascular. The nerves have lots of vessels. Part of the reason people have heart attacks and strokes, the mechanism is through vascular injury, or one of the mechanisms, I should say. So the eye, the mechanism is also through the vessels. A similar mechanism. Yeah.
Tim, great call. Thank you very much. Let's go to Carmen on line 1. Hi, Carmen.
Okay.
Go ahead, Carmen.
Yes. I have a question.
Yeah.
It's kind of confusing.
It's all right.
Why you can't eat sweets when you're diabetic, but when your sugar goes down, you have to have candy or sweets to bring it back up.
Right. Good point.
Well, Carmen, that's a great question. So the problem with diabetes oftentimes is, in type 2 in particular, there's lots of sugar in your blood, but it's not getting inside your cell. So what we need to do is to help move the sugar from the blood to the cell. And there are different ways that we can do that. Sometimes the medicines that we give can overshoot, and too much sugar goes into the cell, and there's not enough in the bloodstream. So what happens then, Carmen, you get something that we call hypoglycemia, or low blood sugar. If that happens at that time, then you do have to take something to correct it. And usually it doesn't need to be very much. One of the things that we don't do a very good job is explaining that it's like 4 ounces of orange juice. It's not a plate of pasta. Yeah. It's just a little bit can get your sugar back up to where it needs to be.
I have suffered from low blood sugar before. When I was talking to Break about going on a low-carb diet a few years ago and not paying attention, and suddenly I got lightheaded, dizzy, and someone gave me a quick couple of sips of soda, and I was right back and okay, and I realized, okay, I need to balance this out a little more and look at the sugar intake, because I had eliminated it, and it was too much.
So I think, to Carmen's point, the only time that we really advise you to take sugar is if, for whatever reason, either our therapy overshot the mark, or let's say you went on a very aggressive diet, or all of a sudden became an ultra marathoner. I'm joking a little bit there, but when you're very active, that actually also lowers your blood sugar, because your body uses up the sugar. So it's in those situations, and they're actually more common in individuals, for example, example, take insulin or similar
Right.
medications to that. So we do have to be attentive to hypoglycemia. So that's a very real consequence of some of the care that we provide, and I really appreciate her calling that out.
Yeah, really good, really interesting. We got a lot of calls lined up, folks. You want to get one more call in, Courtney, before we go to break? Is that all right? Sure. We'll go to Angela next. Hi, Angela.
Hi. I've got a question and a comment.
Sure.
The question is, my grandmother was insulin dependent, and my father developed diabetes later in life. And my background is Ashkenazi Jewish, and they used to say that we had a propensity toward diabetes, and then later on when I was talking to doctors about it, they would say that it wouldn't come up, or so I guess I don't know if the thinking is different now, so I'd like you to address that. And the second thing is, this is the comment, when my father passed away, he was in a different city, and I got the call, and they told me he had a massive heart attack, and I said that's impossible. He has no history of heart disease, and you hear people having triple bypasses and quadruple,
Right.
and he's hit by a massive one with no history. But what I learned subsequently, and I don't think most people realize, is the connection between heart disease and diabetes.
Yeah, which you mentioned before, the vascular issues.
The vascular issues are huge. In fact, the mechanism by which people often die is the heart disease. Usually the other conditions don't lead to death. And I think the important thing there, just to revisit a point, is sometimes when we say diabetes, we get fixated on glucose, on sugar.
Right.
And I think sugar is worthy of our attention because it's important. In fact, it's very important. But it's also very important, in particular for the caller's dad, that we pay attention to those other conditions, the high cholesterol, the hypertension. Treating that is just as important, if not more important, to preventing some of these other consequences. So it really is important to think of diabetes as something beyond sugar. And if you thought about it as a vascular condition, then you start to think, well, what are all the things that impact vascular disease? I think to the issue of inheritance.
And this lineage in her family.
Yeah, no, this is a really thoughtful point. Let me comment that the term insulin-dependent diabetes mellitus is something that has changed. We don't use that nomenclature anymore officially. Obviously, lots of people use it. So insulin-dependent diabetes used to refer to what we now call type 1, and non-insulin-dependent diabetes refers to type 2. The reason we've changed the nomenclature is because it's inaccurate. So a lot of people who are dependent on insulin don't have type 1 diabetes. As a matter of fact, 30% or so of individuals that have type 2, maybe a little bit less than that, are using insulin.
Okay.
So insulin's very commonly used, especially with the newer insulins that we have. They're really outstanding, and you can achieve excellent control with the insulin. So I think with your dad, and I believe it was the grandmother, I'm trying to remember exactly, the fact that one had insulin dependent and one had non-insulin dependent, it actually could have been the exact same condition.
Right.
It's very possible that the insulin dependent was actually type 2 diabetes. So
interesting.
Yeah.
Great call, Angela. Thank you. We've got others lined up. Be patient. We have to take another break, everybody. We'll be back with more of your calls right after this.